Here is my 5 visitors. Okay. Okay. Millions of people all around the world are affected by sickle cell disease. The majority of them are individuals whose ancestors come from Africa, where malaria is found. Individuals who have both hemoglobin S alleles suffer from sickle cell, but those who only have one hemoglobin S allele are more resistant to malaria. Sickle cell disease is an inherited blood disorder in which the body's red blood cells take on an unusual sickle or crescent shape. The red blood cells contain hemoglobin, which is a protein that carries oxygen from the lungs to the rest of your body. When individuals have inherited 2 hemoglobin S alleles, the red blood cells deform into a sickle shape under conditions of low oxygen tension. Once the sickle hemoglobin molecules have relinquished their oxygen, they form a long rod-like structures. As a result of the abnormal shape of the red blood cells clotting, partial or complete blocks in the capillary circulation occurs, making oxygen transportation to your organs and body parts painful, damaging, and it causes low blood count or anemia. As the sickle red blood cells stack up, block the blood vessels, and prevent oxygen from being delivered to the organs, symptoms of sickle cell disease begin to occur. In the United States alone, sickle cell affects approximately 100,000 Americans. Out of the 100,000 Americans, it is estimated that sickle cell disease occurs in about 1 in every 500 African American births, or 1 in every 12 African Americans, and 1 out of every 36,000 Hispanic American births. Children with sickle cell disease oftentimes die of infections in the bloodstream by Streptococcus pneumoniae. Massimini once stated that a blood test known as the hemoglobin electrophoresis can be performed by your doctor to let you know if you are a carrier or if you have sickle cell. All 50 states now actually screen newborn babies for sickle cell using the hemoglobin electrophoresis diagnostic test so that those who test positive can immediately be placed on penicillin to prevent serious infections. The CDC in 2011 stated that penicillin prophylaxis prevents pneumococcal infections and early death in children with sickle cell disease. Though sickle cell disease has no cure, treatment is relentlessly being improved, and doctors can impressively provide relief for sickle cell patients. In fact, from 1999 to 2002, death associated with sickle cell amongst African American children under the age of 4 dropped about 42% due to breakthrough of a pneumococcal vaccine that defends against aggressive pneumococcal diseases. Blood transfusions used to increase the number of red blood cells to treat sickle cell anemia and to prevent some of the complications sickle cell causes. Transfusions are also used to treat spleen enlargement in children before the conditions become life-threatening. Painkillers also, and oral and intravenous fluids are used to decrease the pain and avert problems when it comes to painful crisis. Day-to-day treatments of hydroxyurea, which is an anti-cancer drug, can reduce the occurrence of acute chest syndrome as well as painful crises, and you won't need as many blood transfusions. However, hydroxyurea has also been proven to decrease the quantity of white blood cells in the body, thus increasing your risk of infections. And hydroxyurea does not offer a cure for sickle cell. It only helps control the symptoms. Occasionally, a blood marrow stem cell transplant can offer a cure if it's successful. According to the National Heart, Lung, and Blood Institute, this operation involves exchanging a person's defective stem cells with healthy ones, but it can come with serious complications or sometimes even death. Some hospitals and organizations have created programs to offer counseling to families to help them better understand sickle cell. Information regarding genetic counseling can be obtained from clinics, medical centers, health departments, or anything of that sort, just a doctor. Many treatment options have come available over the past few years to decrease the symptoms and enhance the lives of individuals who are affected with the sickle cell disease. A clinical cure for, excuse me, oh my goodness, sickle cell is achieved with a better understanding of the disease, constant research, effective treatment, and time. Until then, doctors will constantly and adamantly look for ways to enhance the lives of individuals with sickle cell by improving treatments and offering counseling. Yeah, my face is super red. That was terrible.